Hello everyone, welcome to my channel, Body Mind Healing. My name is Maria Sanchez. I'm a holistic health consultant, a family nurse practitioner, a psychiatric mental health nurse practitioner, and a doctor of nursing practice. The case for today is ketamine for depression. Ketamine is a medication that was originally developed as an anesthetic. But over time, researchers discovered that it can also produce rapid antidepressant effects. In depression care, it is important to distinguish between ketamine itself, which is often used off-label in specialty clinics, and esketamine, also known as Spravato. Treatment-resistant depression refers to a major depression that has not improved after at least 2 adequate antidepressant trials. And it was this difficult-to-treat group that helped drive ketamine research forward. What makes ketamine different is speed. Traditional antidepressants often take weeks to begin working, while ketamine can reduce depressive symptoms much more quickly, sometimes within hours or within the first day or two. That does not mean it is better for everyone, but it does make it especially important in cases of severe, persistent, or treatment-resistant depression. Ketamine or esketamine are augmentation options for patients with major depressive disorder who have not responded to several adequate medication trials, rather than as a first-line treatment. In practice, ketamine for depression should be used only under medical supervision. Esketamine is given intranasally in a healthcare setting under direct supervision, not as a casual self-treatment at home. Blood pressure is checked before and after treatment, and patients are monitored for at least 2 hours. Because the medication can cause sedation, dissociation, respiratory depression, and temporary increases in blood pressure, patients should not drive until the next day after a restful sleep, and should avoid food for at least 2 hours and liquids for at least 30 minutes before treatment. The strongest evidence in depression care is for intranasal esketamine and intravenous ketamine. By contrast, oral, sublingual, intramuscular, and subcutaneous forms are being used in some settings. But the evidence for those routes is less established and long-term safety remains less certain. Expert guidance therefore favors treatment in properly equipped clinical environments with clinicians who understand mood disorders, monitoring, and ketamine-related side effects. Ketamine is promising, but it is not simple or risk-free. Common side effects include dissociation, dizziness, nausea, sedation, vertigo, lethargy, and increased blood pressure. There is also potential for abuse and misuse. Some patients need extra caution or may not be appropriate candidates, especially those with certain vascular conditions such as aneurysmal vascular disease, arteriovenous malformation, or a history of intracerebral hemorrhage. For people with major depressive disorder and acute suicidal ideation or behavior, esketamine may improve depressive symptoms. But it has not been shown to prevent suicide or reduce suicidal behavior on its own. The best way to understand ketamine for depression is as a specialist-level option for difficult-to-treat illness. It is not a miracle cure, and it is not usually the first thing tried. But for some people, especially those whose depression has remained severe despite standard treatment, it can offer a faster and sometimes life-changing reduction in symptoms. Used carefully, within a broader treatment plan that includes psychiatric follow-up and ongoing support, ketamine may become an important bridge between crisis and recovery. If you like this topic and want to learn tools to support your mental health, you will find more in my book Through the Storm by Maria Piedad, DMP, available on Amazon. If you resonated with this video, like it, share it, comment on it, and subscribe to the channel. See you in the next video.